Hi everyone. Today I would like to speak on a particular subject called writer's cramp. There are many people who complain that whenever they used to write something, the hand goes into spasm, or the fingers goes into spasm, so much so that their handwriting would be illegible or can't write for a longer time, especially during exams or while writing documents or something. It's been known that this disease is quite common from the 18th or 19th century. It has been reported, and earlier it was called as a paralysis of writers, because this was quite common in the document writers, those who are in the courts and all, who used to document many for longer periods of time. So the incidence or the prevalence of the condition is around 6 to 7 per lakh. The age group is 20 to 50 years. Any gender can be affected, both male and female can be affected. The essence of the problem is that whenever they write, the hand goes either into this flexion or extension, and the writing would be illegible, as well as the pen tends to drop, or the hand assumes certain peculiar postures. This may be a flexor type or an extensor type. It may be a symbol or a complex with multiple dystonias. Dystonia means abnormal posturing with a sustained posturing, and abnormal with a tremor and contraction. So this can occur either alone as a primary form, but around 20% can run in families, 20%. So the problem is that whenever they write, it will be illegible. And if they sign any document, maybe a check and all, it would be rebound. I mean, they won't give you the money, or the check won't be received by the bank. So this can occur either primary, only as a writer's cramp, or maybe part of a whole body process like a hemidystonia, segmental dystonia, or a generalized dystonia. Can occur as a part of DYT1 mutation. There is one disease called dystonias. Many types of dystonias, or it can occur as a part of one condition called Sagava's disease, or a DRD, or dopa responsive dystonia, which is exclusively or exquisitely sensitive to levodopa, small dose of levodopa. So it may be simple or a complex with multiple dystonias, and that this is task specific. So the writer's cramp occurs only with writing. There are other dystonias like musicians' dystonia, typewriters' dystonia, barbers or hairstylists' dystonia, shoemakers' dystonia. Many forms are there. Musicians, those who use organs, violin, guitar, other drums, and any sort of musical instrument players, they are prone for this. It is said that it is due to an abnormal rewiring the brain. Because of the constant or repetitive action of a particular act, the brain senses that it gets rewired, and whenever they do the same act, this would go into particular postures and dystonic postures and tremor. Sometimes there may be some problem with a muscle called a pronator teres, which goes into spasm, can also give us to abnormal posturing. There is one condition called primary writing tremor. Whenever you write, the hand goes into tremor. That's treatable with the medication. So the treatment is many drugs have been tried. You can have physical therapies, occupational therapies, acupuncture, biofeedback, mirror therapy, sensory re-education, proprioceptive re-education, wax bath. Many other physical therapies have been tried without much effect. Even thalamotomy, Venro intermediate nucleus of thalamus has been lesioned to improve this. Then new neurectomy or repositioning of the nerves. Many things have been tried. Then many drugs have been tried, like baclofen, clonidine, propranolol, mycilin, baclofen, tetrabenazine, benzodiazepines, phenytoin. Many drugs have been tried without much effect. The drug which has some effect is trihexyphenidyl. The other most important drug which have been used for 20 to 30 years is botulinum toxin. In my opinion, the best therapeutic option would be botulinum toxin, which can be given fairly at shorter intervals, maybe 2 weeks, 1 month or 2 months or 3 months. Ideal would be 3 months. Initially, because if you give injection, this may not be effective. So, we have to see which other muscles are all acting much more than is required. So, you have to give that botulinum toxin to those particular muscles also, to the hyperactive muscle, which can be given by local palpation, or you follow the pain or the spasm, or you can put a EMG, electromyogram. There is a needle, you put a needle here and ask the patient write, and so that you know that which all muscles are hyperactive, whether it's a flexors are hyperactive, or the extensor indices are hyperactive, or extensor pollicis longus is hyperactive. So, you give around 5 to 10 units in those muscles here, because these muscles are quite sensitive, and you can give higher dose to the flexor compartment. Sometimes it can flow to the forearm, arm and the shoulder. In those cases, you may have to give injection to those muscles as well. Okay. So, you can have the botulinum toxin plus the physical therapies and certain drugs like trihexyphenidyl or some other TENS or physical therapies also. So, giving a multimodal therapy would be much more ideal. Okay. So, the other condition, as I mentioned, maybe some nerve palsy like median nerve paralysis, ulnar nerve paralysis, or a radial nerve paralysis, or a radiculopathy, or a part of a myelopathy can all present with a dystonia and spasms. You have to find out whether there is any underlying cause. Okay. Similarly, any brain lesion can rarely give rise to focal dystonia, especially those who had a injury, trauma, or any perinatal insult during infancy. So, I will conclude here by telling that writer's cramp is not that common, maybe 5 to 6 to 7 per lakh, and it's said that 17% of people would stop writing because of the poor handwriting, because all this problem related to the writing would be so ridiculous, so bad and worse that they won't get any check or sign, or any documents would be returned to them, said it's not you or someone else. So, I think that I've given you a brief idea regarding writer's cramp today. So, if you have any comments or queries, you can always comment. Thank you very much. Bye.